Hey Fix listeners, I want to take a minute to give you all an update on our DPO, Smile Now Dental Group. In case you haven't heard, we've been opening up locations all across the country for doctors just like yourselves. We started several offices this year to show proof of concept, and it's been off to the races ever since. So if you're looking for an equitable partnership opportunity where you can have a profitable business that supports you doing full arch, I'd love to hear from you. We're looking to add several locations in the next year and want to offer the training and support necessary to make one of those yours. If you'd like to learn more, you can go ahead and hit me up on Instagram at Dr. Tyler J. Tolbert, or shoot me an email at tyler@smilenowdentalgroup.com and say hey. Now, without further ado, let's get back to the show. My name is Dr. Tyler Tolbert.
And I'm Dr. Soren Poppy,
And you're listening to the Fix Podcast.
your source for all things implant dentistry.
Hello, and welcome back to the Fix Podcast. So you may notice that we're missing someone today. So Dr. Poppy is off on his first vacation in like 2 or 3 years down in the DR with his beautiful girlfriend and spend some time down there. And I'm back here recording podcasts, but I'm actually having a really good time. And today I have a special guest with us, Dr. Drew Phillips. So he and I actually have some similar beginnings. So we both graduated from the Dental College of Georgia. So we're some down South Georgia boys that have come out to a different part of the country to do a whole bunch of full arch. And so Dr. Phillips here has an incredible body of work. If you're unfamiliar with his work, it's pretty impressive. I suggest you find him on Instagram. He is a fully remote Anchorage capable full arch doctor, and he hasn't been out much longer than I have. What year did you graduate, Drew?
I graduated 2019.
Yeah, so not much further along than me at all, but so much further clinically. So I've been so impressed with everything you've been able to do, and I've been anxious to hear about your clinical progression and how you got into doing what you've been doing for some time, and what better way to do it than live on the show. So really appreciate you taking some time out, and I'm anxious to get it going.
Yeah, for sure.
Awesome. So for those that don't know you, could you just kind of give us some description of your background, your general story, how you got to where you are, just the overarching view?
Yeah, so it's funny. I'm actually from Georgia originally. I kind of grew up only knowing anything medical. My father is a radiologist, and I grew up wanting to be, some sort of surgeon. Originally it was an orthopedic surgeon, and I had the opportunity to shadow basically every surgery there is in the hospital, anything from like total hip replacements to just simple stuff. And the thing that they all had in common is that they told me if they were to do it again, they would be a dermatologist or a dentist.
Mm-hmm. I heard that a lot. Yeah.
And I was like, oh, okay. Well, dermatology sounds terrible. And, my father being a physician is like, dermatology is terrible. Don't do it. I mean, yeah it's good money.
You don't want to
and
be a pimple popper?
Yeah. I mean, it's one of those things where it's like, the diagnosis 99% of the time before you even walk into the room. So it's like, they make good money, but like, I want something more challenging and something,
right.
I think that would be more fun. So started looking into dentistry and really enjoyed it. And my sister as well. My sister graduated dental school 2 years before me.
Okay.
So she's a pediatric dentist here in Boise as well. So I went to college in Florida and then ended up going to dental school, in Augusta. What a wonderful place Augusta is. One week a year.
Yeah, that's
it's
right.
like everyone's like, oh man, Augusta, that must be such a cool place. And I'm like, yeah, one week a year. It's really cool.
Try the other 51 weeks.
It's like the city spends like the 2 weeks before the Masters cleaning it up, making it like a really nice place. And then the day it's over, man, it's all done. Back to old Augusta.
And I never really spent much time during that period because I would always just like rent out my condo or whatever, and then I'd skip town. So I never even really saw it during that golden moment. I saw it for what it really was, but you know what, that's the crucible that we both went through, and here we are. So I'm appreciative of it.
Yeah, it's funny. One of my classmates, his house was close to the National, and one year he just with dental school he just like hadn't cut his grass, and they came over and was like, "Hey man, can we cut your grass?"
That's great. You just hold it out.
Let them take care of it. They have a vision they want people to think, but it's great. I go back every year for the Masters. It's a good time. So I went to dental school, Dental College Georgia, Medical College Georgia, Georgia Regents, whatever whatever you want to call it.
Depending on who you ask. Yeah.
Dental school was dental school. It was funny. I'd never made straight A's until I went to dental school.
Oh, really?
Yeah, I
Is that
was
right?
never a great student. I think in college, I had a great time in college, but I think my science GPA was like a 3.2 and standard GPA was like maybe a 3.6, which
Yeah.
compared to like my dental school classmates was like not anywhere near theirs.
Yeah.
But I killed the DAT. It was like I studied for that thing like it was a job. It was like 6 days a week, 10-hour days. It was funny, like 2 weeks before the DAT, like I realized like how to take the test. Like everything finally clicked and I was like, oh, wow, I don't really need to know this information. I just need to know what the wrong answers are going to be. And then I just pick the right answers.
Yeah.
Like, it's just like a game. And it's fine. I've actually helped a lot of people with the DAT since. And yeah, so I did really well in the DAT and,
Nice.
And so I got into dental school, which it was like my dad was like, hey, Drew, like, you should look at some other options. Just kind of like, it was one of those things, it was like, but, I got really lucky and got into dental school and, made the first, I think it was like the first test, like a biochem test, made it like a 93 on that. And I was like, oh shit, like maybe I can do this thing. Cause like, I'll admit, like I went to dental school, like my sister, she'd been a straight A her whole life and made 1B her first semester in dental school. So it's like, well, shoot, if she didn't do
reality
this,
just came crashing down on her.
Yeah. It's like, there's no way I'm going to make straight A's. I was like, I go like through dental school. Like when I get in, like my whole mentality is like C's get degrees. Like, let's just get out of dental school.
Yeah, totally.
But yeah, I ended up doing really well. And, I worked my ass off in dental school. And, so I ended up graduating. I was valedictorian of my class. So, everyone was like, so I ended up going to a GPR. After that, I went to the VA hospital in Salt Lake City. I had I ranked that number one. There's some other great programs I was looking at.
What attracted you to that one?
So, there's a few things. So the other one I was really interested in was the Foundry in Alabama. The VA in San Antonio had a really good reputation. A few others had really good reputations. The one thing I really liked about Salt Lake City was number one was location. I grew up, we grew up skiing. We were not like a beach family. We were a ski family. So we were always out in Utah skiing. And that was a big drive for me. Kind of, I guess, jumping right into like my residency after dental school was the thing I loved about the VA in general was the fact that patients didn't have to pay for treatment. So, it's good and bad, right? Like I never learned how to sell treatment and how to sell my treatment plans, but I learned how to basically do everything. And that the VA in Salt Lake City specifically, we had a different specialist pretty much every day of the week. So, it was like Monday we had endo, like every Monday afternoon we were doing molar endo. Every Monday morning we were doing, we had an oral surgeon. We had a day with Thursday was perio, Thursday was pros. Some Tuesdays, I think we had an oral surgeon. And then on top of that, we had, a handful of really good GP attending. So, we really got our hands in every sort of specialty and learning from those specialists, as well as running from the GPs there, which were doing a lot of the same thing. I'm really thankful for my GPR. I think it gave me a little bit of a head start. It was cut short with COVID though. COVID hit, I think it was like March of that year. And I remember I was one of the first 100 people in Utah to get COVID. I was like, there's the state's,
no way.
I was like, the state's like specimen. They were calling me like multiple times a day. And I'm like, guys, I'm fine.
You got to lead the pack. That's your whole personality. You got to,
yeah. It's just like, I'm fine, guys. Like it's not a big deal. I'm just chilling in my house, Ubering, getting Uber Eats. And,
wild.
But I think the one thing that my GPR probably taught me the most was how to do dentures. I mean, we did a ton of dentures in my GPR. we were doing full mouth extractions. We didn't do any full arch in my GPR. Our standard of care was 2 implants, mandible, first snap denture, complete upper denture. But it taught me a lot because dentures, I think, are like the basis for everything. And I see so many people, I get hit up on Instagram pretty frequently with people being like, hey man, like how do I learn how to do this and things like that. And I'm always like, go learn dentures, go work at affordable dentures or something like that. And just like do dentures.
Just a year. Yeah. Yeah.
Because I mean, you could tell me like, hey man, I want to do veneers. I want to be like Dr. Appa. I'm like, okay, go learn dentures, because it all starts with, where you put in your incisal edge and the bite. Like dentures is like the basis. And man, we hated dentures in dental school. Like everyone hated them.
Oh yeah.
Freaking, I mean, Metzler still, like I just, what's funny about Metzler actually, and I hope he actually listens to this or someone should send it to him, was he worked at the VA GPR before,
no way,
before he was at Georgia.
I didn't know that.
Yeah. I remember seeing patients and I'd like scroll back, look at their chart and be like, what's done? It's like Kurt Metzler. I was like, oh shit. What's up, man?
He's the man. I still, it's funny in retrospect, you look back on those guys and you're like, you know what? You made some core memories for me that, some of it's bittersweet, but you know what? It's a memory.
Seriously.
I could still hear Thunderstruck for every RPD practical that I did.
Yeah. I can't say I did any parcels after dental school, but yeah, I mean, so, learning dentures, I think, is just an invaluable thing. And also the other thing it teaches you, which I think is invaluable, is like patient management,
Totally.
How do you speak to patients? How do you set expectations for these type of patients? So my GPR, I did, about 100 implants, I think, a few immediates.
That's fantastic. Yeah. Those are mostly in the context of an overdenture.
We did quite a bit of single implants.
Okay.
We did, I did a lot of sinus grafting, really not much like direct sinus grafting, a lot of lateral sinus grafts. I still remember my first one. My attending Lane Brown, he did one, the person needed bilateral and he did one side and I was meant to do the other side. And like right when I was starting, we had a whole bunch of people show up that were like interviewing or visiting for the GPR. And I'm sitting there with like 4 people over my shoulder. Lane, Dr. Brown, he had already left the room. He like went to go do something else. He's like, you got it, man. And, I'm like trying to do this thing. And I got all these people over my shoulder and they're like, I have no idea what I'm doing. And they were like, it turned out good, but so we did a lot of that. The other thing that, we did was anything we did on the mandible, like you flap down to the mental nerve. So I see a lot of people learning full arch now and they're like, everybody wants to make these like little baby flaps. And I'm like, you can't see anything. You don't know what you're doing. I mean, I flap and every now and then the drill comes out the buccal plate or, an implant. And I'm like, wow, if I didn't have it flapped, I would have never seen that,
know it. Yeah, totally.
So, I was never scared to make big flaps because we were forced to. I mean, we were.
That's great.
So that was my GPR experience. It was really invaluable for me to work with all these specialists and, do a lot of dentures, even though I didn't like it while I was doing it. I look back on it and I'm like, man, I wish I would have done more of these or.
Yeah, it's invaluable. Yeah. Yeah. So like at that time when you were going through the GPR, was your mentality that you were going to be like an omni-capable GP, or was there like kind of what was the end in mind?
So, out of dental school, I didn't know what I wanted to do. And everyone was like, oh, why aren't you going to ortho, or why aren't you going to oral surgery? And, ortho was out from day one. To me, that just sounds not fun. And, good for you, orthodontist, but it's just not for me. So, GPR for me was just like that next step. Out of dental school, I thought that I might like endo. And after like 2 molar endos, I was like, I never want to do this ever again.
I was under no illusions.
Yeah.
When I came out.
My first root canal out of residency was like number 19 and broke first file ever broke, first patient out of residency. I was like, wow. I think that was the last root canal I ever did.
That's great.
But yeah, man. So it was, I loved it.
Hey guys, I just want to take a beat to talk about one of our sponsors, SIN 360, specifically their full arch digital workflow. Here at the Fix Podcast, we've been using SIN for about 2 years, and one of our favorite integrations from this workflow is the Micron Mapper. Photogrammetry is an absolutely pivotal technology that has changed the way full arch is being done. It's allowing us to capture implant scans in under 5 seconds with micron level accuracy that's beating any type of scannable verification jig or analog verification jig, what have you, and it's able to do it in under 5 seconds. And guys, SIN 360 is absolutely giving this thing away right now for $699 a month for 39 months with 0% financing. Think about that, $699 per month. That's about the cost of an analog conversion or fabricating an analog verification jig, or maybe even just a scannable verification jig. So I highly, highly, highly recommend you try this out. It's one of the most pivotal investments that you can make in a full arch digitally capable practice. To learn more, visit sin360.us/thefixpodcast and get yourself a Micron Mapper today.
Yeah, cool. So you're coming out of GPR, and you have the sobering reality of breaking off a file at a number 19, and you got all these skills with like dentures and surgery and implants. So what was the next step? How did you kind of transition from there? What was the direction that got you kind of more in the aim of surgery?
So my GPR kind of got cut short. There was about 3 to 4 months,
right?
So there were still some things that I wanted to do and learn before I kind of like dove right into whatever I, ended up wanting to do, which I really still didn't know. I still had this idea in my head that I really liked cosmetic dentistry, and that was not something that I got to do at my GPR because it's the VA and we do functional.
Yeah, it wasn't so elective. Yeah,
we do functional dentistry, not aesthetic dentistry. And so I went to go work at an office in Salt Lake City, where I was doing a lot of sedation dentistry and,
cool.
I was doing, probably 1 to 2 sedations a day, just whether it was fillings, crowns, implants, things like that. And I was there about, I think 5 or 6 months, before I left. And I started doing some full arch there. I probably did maybe 20 arches while I was there. Most of them were all under my own sedation too, which is, I would never do that again.
And were you doing your own conversions as well?
So there was like a quote unquote in-house lab there. So they were kind of doing the conversion. I mean, we were helping, but for the most part, they were doing the conversion, and then we were restoring. So I think like if I, going back to, I think, they wanted me to do something like 20, take like 20 patients to finals or something like that before I did my own surgery, which is for sure the right thing to do, is to learn the prosthetic aspect of it before you start, throwing some implants in.
Sure.
I remember my first case still. It was a double arch. The owner of the office was supposed to come there and like basically hold my hand through it, and 20 minutes before I called him and I was like, yo man, where you at? And he's like,
you got it, bud.
He's like, I'm not going to make it. And I was like,
and then 4 people came into the clinic to watch you do it, right? This is what happens.
Thankfully they had assistants there that had done enough of them. Like they could probably do it themselves, but my first double arch took me pretty much exactly 4 hours. Still remember it.
It's actually not bad.
It's
not bad at all.
Yeah. I was super proud of myself.
And
I think it healed well. I don't really know. So I was there, and then I wanted to get out of there pretty quickly and was just looking at some different options. And that's kind of when I was like, okay, do I want to go somewhere where there's like a lot of more of like aesthetic dentistry? So I was looking at an office and working at an office in Park City, or do I just want to go completely something different? Because this was really this office I was working at in Salt Lake City was really my first experience to full arch, and I liked it. What they were paying me to do it was not worth my time. Like I could have just been prepping crowns and I would have made more money, but I liked it. I wanted to kind of see where it went. The office I was looking at in Park City just really kind of didn't work out. So I went to California and was working at an office there that had another in-house lab that was doing a lot of a lot of digital workflow stuff. And
cool.
So I was there.
So was this like 2020, 2021?
So it was like graduated 2019. So this would have been like, I think it was like December. I started like December of 2021.
Okay.
2021.
Okay.
And I did quite a few surgeries there. I did a ton of sedation, but the aspect of them having an in-house lab was huge for me, and becoming friends with the lab tech there. It's a guy I'm still friends with. He's actually out on his own. It's AOX Designs. Joseph Rodriguez, he's the man. Him and I are still buddies. We still, talk about cases together. Him and I created some protocols together. So just learning the digital workflow there was huge. And that's really what
is that with Gus Khalil? Is that
no?
that same operation or
AOX? It's is it? What is his name? Joseph? No, it's not with Gus. That's actually where I met Gus, though.
Oh, okay. Yeah,
Dude,
I see
all
their
these
website.
people. What is his name? Joseph Rodriguez.
Okay.
Whatever.
Cool.
But yeah, he was the man. And that's where kind of like my CE journey started, and that's where I became addicted to CE.
Nice.
And so I took a lot of CE courses that year. And that was like my first kind of remote anchorage CE course as well.
Nice. So you were actually doing the fixed arches prior to really taking the CE courses. It was more just, experience in residency and then whatever was happening in that first place that you went to that kind of,
Yeah. So it was kind of like a see one, do one, teach one sort of thing.
Got it.
Right. Like I watched a bunch, I restored a bunch, and, I had the basics, right? Like I was fine laying a flap, which again is something that like conceptually seems really easy to do. But you watch people that are new at it, or I go and like mentor people, and I'm like, man, that flap's got to be way bigger. I mean, like, look at what we're doing,
thickness, and you can't see anything. There's blood everywhere.
Yeah, it's
periosteum all over the place. Yeah,
the basics. I had the basics of pretty much everything. I was comfortable around the sinus. I was comfortable around the nerve, and so you just kind of have to put it all together. And so that's where I started my CE journey.
Cool.
And, that was, I guess, my first CE, like remote anchorage as well.
Wow. Yeah. So you kind of like were already kind of going straight to some of the more advanced techniques, like right off the bat with your CE. Yeah, that's cool.
Yeah. It was, after that, I guess maybe I took some steps backwards, but, remote anchors is not something I ever wanted to do. And the first course I took was a live patient course with Vishy Broman. In his office in Arizona. And I remember I had already become friends with him, and he was doing a course, and I was like, man, do I really need to learn this? Like, this is so out of my league. There's no like, and he's like, man, you're young. You're going to be, you're going to see your own cases fail. I'm like, that's the scariest thing to think about. He's like, you should at least learn how to do it, whether you do it or not. And, I probably took that course too early, and I don't think I did any Zygos. I probably did a handful of pterygoids. Didn't do any Zygos for about a year until I was probably like 8 months after that course was my first Zygo case.
Okay. Yeah. And that's a really big gap.
Yeah. I did
from the time you learn to the time you implement. Yeah.
I did 2 in one day. It was a husband and wife.
Nice.
They were,
great.
It was.
Did you know that they were going to be Zygos before you started?
I did.
It, or was it kind of like a necessity? Okay.
Yeah. So a little story with that. My parents were still living in Georgia, and we'd had this. The lady that cleaned our house, she'd been, she took care of our dogs. I mean, she'd been there when I was a small child, and
cool.
I don't think anyone in my family ever realized they had like teeth problems, and I guess they like saw what I was doing and Instagram or whatever, and went to my parents and was like, hey, like, we went to Clear Choice, and we got these, it was like back then Clear Choice was charging probably like $60,000 plus $70, something crazy that. And I was like, well, like go get a CT, Clear Choice wasn't going to share the CT. I was like, go get a CT somewhere and send it to me. And I immediately saw it, and I was like, Clear Choice said they could do standard all-on-4 in this. There's no way. Like, both of you guys are Zygos, like 100%. And I was like, well, I took a Zygo course. They're nice people.
Some time ago.
Yeah, these people are nice.
Yeah, cool.
Like they've helped us. Like, so I did them for free, and we did them both in the same day.
That's amazing.
And we did them at a friend's office in Oregon.
Okay.
And from what I know, they're still good. I mean, they see my friend's office in Atlanta for cleanings now, and
Nice.
yeah. So that was my first Zygo patient was husband and wife.
Wow, that's awesome. So were like, like, was it like a quad Zygo, or are you doing like a single on one side, or what?
Yeah, so they were both just posterior Zygos, and look, I didn't even do pterygoids on that case because I mean that took me so freaking long, and I was just like, I've got posterior Zygos on both, just 2 implants on the anterior for both of them. Both of them got 4 implants on the lower. One of these days, they'll probably come visit me in Idaho or in Oregon or wherever I'm working somewhere, and I might go and add some pterygoids to them because I want them to last for the rest of their life.
Ideally.
But I haven't even looked at like the post-op CBCTs. I'm sure the Zygos are right in the middle of the bone. Right where they shouldn't be.
Right where you wanted them.
But
you split the field goal. That's great.
Yeah. Got to start somewhere, I guess.
Yeah, no, of course. Yeah, no, I mean, props to you for just kind of going in head first with that. I mean, a lot of people will take, 3 or 4 courses. They'll want to do a few cadaver courses, some live surgery, and then still want to do some over the shoulder, which there's merit to that, of course. But at the same time, I've noticed that a lot of the people that, end up teaching these things, they can kind of be a little bit of cowboys, if you will. Maybe that's kind of a derogative term, but, people that are willing to, feel confident in their abilities as soon as they, understand the full scope of it and understand that you're not really going to know how to do it until you do it. And I think that kind of service for a patient that otherwise wouldn't really be able to get something that would be a standard of care. I mean, if there's a Zygo patient, why would they get, standard all-in-4? So, that was really cool. And so after that, did that kind of, make you feel like, okay, I want to do a lot more of these cases, or how did you feel about it?
No.
Really?
I still like every time I see a Zygo case, I'm not like, oh man, I can't wait to do this. I'm like, oh, really? Like, I gotta do this.
That's a good attitude, actually. Yeah, that's how it should be.
I mean, like, I can do them, and I will do them, but it's not something that I like go strive to do and like really enjoy because it's exhausting. It's high risk. Yeah. I mean, it's high risk for anyone, whether it's GP, perio, oral surgeon. It doesn't really matter who's doing it.
Yeah, you bet.
And, thankfully I've not had any Zygos fail. I haven't had any huge issues from Zygo patients. I mean, honestly, my worst complication on a patient I've had is on a lower arch where the guy had the only teeth I had to take out was both canines. The only thing he had left. And that was like the worst like, it was just like a total massive infection, just hospitalized. Like it was just like a total disaster that, I'm like, man, what could I have done differently? And I feel like I did everything right. Yeah. And he's got Zygos on the upper. I was like, really? Like it was I think it was 2 years ago. It was the hardest Zygo case I ever did. Like I drilled once, couldn't get torque. Drilled again, placed, couldn't get torque. Third time on this, it was, I can't remember left or right side. It was like finally got torque. I'm like, man, this is the hardest Zygo case I've ever done, and I get a complication on the lower.
Yeah, the irony. It's always the ones you don't see coming.
Yeah,
I've definitely found that the ones that I worry about tend to work out, and then the ones I wasn't worried about just totally disregarded. Like those are the sneaky ones. They
oh get you. Yeah, the cases where you load it, it's like 100 Newton centimeters composite torque value, and it's like. Everyone just go home and say your prayers and they heal amazing.
Yeah, no problem.
No problem whatsoever.
Yeah. No, I totally get that. So you placed your first Zygos about 8 months after that first course, still not feeling entirely psyched about them. What kind of made you want to go a little bit further down the road of doing more fixed full arch and atrophic cases?
So this is when I started traveling to Oregon a lot. So I'd moved to Boise at that point. I was working at an office here covering for a friend's maternity leave.
Okay.
Was doing that, was traveling to a couple of different offices in Oregon, and, we didn't stock Zygos, and we started just getting some cases, and I was like, well, I'm kind of forced to do these now. So I just started doing them, and I hadn't taken any other course yet. I remember this was years ago now. I went to a transnasal course in Boston. It was just like a 1-day course. It was like David Zelig and Simon O was teaching
sweet.
it.
Yeah.
And
awesome. Okay.
And it was a transnasal course. They talked a little bit about Zygos, but it was my first time meeting, like David Zelig and Simon O. A lot of the other guys I'd already met before, just through different courses or whatever. And I can't remember if Juan Gonzalez was there or not. But anyway, like, again, like that course, like a few weeks later, I did a transnasal.
Nice.
That's been, I think, December was 2 years. Still have not seen that patient for post-op, but
Well, I mean, it's fair to assume that things have worked out.
Yeah, as far as I know, they look great. But
Great.
So, I'd probably done, I don't know, 10 or so Zygo cases, very few quads, maybe a couple quads. I mean, even still, like I've only done a couple quads. And so then I loaded up a case. I loaded up 3 Zygo cases one day, and I had Juan come do those cases with me in Oregon at the office I was at there. So Juan came, and we did 3 upper arches in one day. I think a couple transnasal, couple Zygo, and it was great. I mean, it was, anytime you do something with any other doctor, like they're learning from you, you're learning from them. I was learning some Zygo stuff from him. I was showing him how I was doing my pterygoids, because I was placing my pterygoids with just standard neodymium implants and had like, upper 90 success rate of every time I placed it. And, I wasn't using the Norris that, arguably was a better designed pterygoid implant, but I was having great success with just the neodymium, like 3.75 by 18 helix, and had great success with it.
For me, yeah.
And, so I showed him kind of like what I was doing with that. I was using some osteotomes from Salvin. I was using some osteotomes from Norris, just kind of figuring out what worked for me. And, so it was cool just kind of collaborating with him on that and learning, each of us learning from each other. And
so are you kind of like are you a drill osteotome hybrid type of guy? Is it, I mean, how do you like to do it?
I keep changing my ways of things.
Yeah.
So I love the Norris, the 2.0 sharp osteotome, which I think, I think the SIN one is almost identical to that now. You can also get it from like GDT for like $90 as well. And so I at least just try to push with that till I can feel something hard. Sometimes it's hard already. And, when I have that, I'm like, great, like almost doesn't matter what I do now. Like we're going to get torque.
You're good to go.
So I'll push with that until I feel something hard. And then I will just take like a standard spade drill and go really slow and just feel until I perforate the plate. And if something doesn't feel right at that point, I can kind of redirect.
Right.
Okay. And then I have I believe it's 2.7 millimeter osteotome from Salvin that I got. My friend Shivane Gupta is an oral surgeon in Atlanta, told me about that. So I bought it back now. And so I got that. And, basically with that, if I can get that down to like 12 to 14 millimeters, like I go straight to placing the implant. If it won't go in, then I'll pick up a 3.5 drill and go a little bit more. But what's awesome about that neodymium helix is, you open up, a cortical plate with the 2 millimeter drill, like you can almost guarantee yourself that it's going to grab and go in there.
Yeah. Bite, yeah.
Every now and then it would, an implant would hit it and it would spin, and pretty simple, just pick up the 3.5 drill and just, I leave it on like the 40 Newton centimeter or RPM speed and just barely open it, where you can kind of feel every turn and just cutting just to open it up enough. And
I see.
And yeah, I mean, as long as I'm in the right spot, like my success rate is really high with my pterygoids.
Great. Yeah. Fantastic. Okay. Awesome. So that's your pterygoid, general routine there. So anything special would you say about your Zygo technique? I mean, would you say that's kind of like a, I guess the way I should put it is, what kind of school of thought do you generally have in terms of your approach to Zygo, your surgical approach with it?
So I have kind of like I guess jumping off of CE, we can go back to CE if you want some other ones, but like,
Sure. Yeah,
my,
please, yeah.
my general approach, like, I guess like kind of in my head, like my algorithm of like how I'm going to approach each case, kind of like jumping into like Patsy protocol, if you will. So for me, it all comes down to like where the sinuses are. Right. And so that, like where the sinuses are, it dictates like where my pterygoid implant starts. It dictates, am I going to do a Zygo? It dictates like how my front 4 implants are going to be. So, my train of thought is if I can get, first of all, we don't want cantilevers if at all possible, right? So if I can get an implant at first premolar and a pterygoid, I don't need a Zygo. I feel like that spread is fine.
Yeah.
If I can get one at second premolar, great. And you can argue that on those cases, a 1-tooth cantilever for a molar is okay. I mean, we don't like cantilevers. However, ClearChoice has been doing that for forever.
Oh, that's the vast majority of cases that are in the mouth, right?
And I have pterygoids under my belt. So yeah, I do them for most cases now, but look at what ClearChoice has done. I mean, they've done more than anyone else. And like their standard of care is just 4 implants, giving them a 1-tooth cantilever. And, the people I know that have been there for a long time say they have great success with that. So my kind of algorithm is like, if I can get like first premolar and a pterygoid, I don't need a Zygo. If I can get, first premolar and I don't get a pterygoid, I need a Zygo. Anterior is whatever. There are some cases now where it's like, I've done things, where I would need a quad, and I've done, whether it's like transnasal implants. I have one case, again, all these cool cases I've done, people refuse to come back for post-ops. So I have a case where I had, I had like, I think like 6 millimeters, maybe it was like 5, like, under the nose. And I did pterygoids, 2 like first molar Zygos. And then I placed 3 helix short right in the anterior. And it was all cortical bone. Okay. So it wasn't like your standard. I mean, it was cortical bone. I'm like, this bone's not going to. I talked to Dr. Molinari about it, and he's like, yeah, that's a great idea. So I placed, 2 like in about the lateral spot and 1 in the nasopalatine. Just those those were my first helix short implants I placed, and got great torque. It was all cortical bone. Again, I probably did that. I was like right after the helix short came out. Again, still haven't seen that patient back. It's like all the cool stuff. I don't see anything back.
That's brilliant, man. Awesome.
But yeah, I mean, when it comes to Zygos, again, it's like, it's just the flap and being able to see everything. Like, what's the difference? And, doing a half-ass flap or just being able to see everything. The one thing when it came to my flap that, I learned from, so I took a, Alex Savoni's course in Brazil with, Dan Rosen and Dennis Smiler. It was funny. I was never planning on taking that course, and I had a buddy that periodontist was going to go, and I was like, yeah, man, I'll go with you. And I think he had a family emergency, ended up not being able to go. And so I went. I had a great time. Nice. And one thing Alex Savoni is like, he was always getting me to flap like more like posterior on the arch, which like really opens it up a lot more than just trying to like only where the implant goes. And, so, it's, again, like bigger flaps. I don't really use any of like the special Zygo retractors. I use a Minnesota. I have a pretty cool Minnesota. I don't know the name of it. It's a Minnesota with more of a handle. There's I think they make one that's like an Ergo Minnesota. It's not that. It's a little different.
I've seen this. Yeah, I saw it at Clark Damon's course. I think
it's just a longer Minnesota basically, and I love that thing. I have like another instrument. Salvin makes one. I think they call it like the Zaga 3. I think Nestor posted about it today. I got one from like H&H Instruments. Just basically like the shape of like a Molt 9, but it's just like 3 times the size. And for me, it's really good for just blunt dissection.
Just a spoon.
Yeah, it's just like a big spoon. And so, just different things. And, the Brazil course was great. Brazil is my favorite place I think I've ever been. I love Brazil.
Yeah, it's great.
Love everything about it. I've been back. I think like I've been back. I went back this year for another course too.